Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Our topic today about antenatal care. So, what are the objectives of this lecture? To know the definition of antenatal care, the aim, antenatal visits, what is the frequency of the visits, what is the aim of these visits, and so on. Identification of risk factors during antenatal care, information to be checked in such visits, antenatal advices as regard the nutritional, traveling, clothing, and so on. And lastly, vaccines during pregnancy. Okay, let us start with the definition of antenatal care. This is a program in which a care provided by skilled healthcare professional is given to women throughout pregnancy, and it includes risk identification and screening, prevention and management of pregnancy-related or concurrent diseases, health education and promotion. So, this is care provided by skilled healthcare professionals to women throughout their pregnancy. This is as regard the definition. Okay, more information about the aim of antenatal care, prevention of common complication of pregnancy, monitoring and treatment of pregnancy complication, like pregnancy-induced hypertension, gestational diabetes, and postpartum hemorrhage, advice and counsel on nutrition during pregnancy, health education to all patients about problems and the hygiene of pregnancy, physiology of labor, infant care and feeding, laboratory investigation that may assess general health and detect medical problems. Also, to classify the patient into normal or high risk pregnancy. Of course, this is very important to know if your patient is normal or low risk pregnancy or high risk pregnancy, because high risk pregnancy needs special care and also needs care in a tertiary hospital. Okay. Also, to give the proper management accordingly. Prepare the lady for breastfeeding. This is as regard the aim of antenatal care. Okay, what about importance of preconception care? Here we are not talking about antenatal, we are talking here about preconception care. Preconception care is important to provide health education, risk assessment, avoidance of harmful and teratogenic factors, and ensuring an optimal dietary intake. So, preconceptional care is important. If there is anemia, we should correct anemia. If the patient is taking derivative of vitamin A, which is a teratogenic, should be stopped for adequate time before planning for pregnancy, maybe 3 months or 3 to 6 months. Okay, because it is teratogenic, and the other drugs may be teratogenic and should be stopped before planning of pregnancy. Okay. Also, what is the importance of the preconception care is to observe or control chronic medical disorder before planned pregnancy. If your patient is diabetic already, type 2 diabetes or type 1 diabetes, diabetes should be controlled first. If she is hypertensive, you should control hypertension before planning for pregnancy. And you should control diabetes. If there is thyroid dysfunction, you should control the thyroid dysfunction, and so on. So this is what's called preconception care. Okay, what about the antenatal visits? The minimum required, as mentioned by WHO, is 4. One at the first trimester, we call it first antenatal visit. Second one, antenatal appointment at 18 to 20 weeks gestational age. Then another antenatal appointment at 28 weeks. Then another antenatal appointment between 35 to 37 weeks gestational age. This is the minimum. The minimum visits, as mentioned by WHO, is 4. This is the most important for time of visits or appointment during pregnancy. But the optimum is 8 or more, okay, as we'll see later on. Okay, but please remember these dates. 1 in the first trimester, the first antenatal visit before 12 weeks. Second, at gestation age 18 to 20. Third, at gestation age 28 weeks. Fourth, at gestation age 35 to 37 weeks. Okay, let us start with the first antenatal visits. It is important because you are going to diagnose first pregnancy and have an accurate dating. Also, complete history taking, including personal history, complaint, menstrual history to know the last menstrual period, to calculate the gestational age. Also, obstetric history to know if there is any problem as regard obstetric history before. Also, medical history, any drug given, past history of medical disease, mental disease, psychiatric conditions, or treatment from psychiatric disease, or any psychological trauma, history of diabetes, hypertension, epilepsy, also family history. So it is very important to take comprehensive history taking, okay? Also, you should know the occupation of the woman, discussing any risks and concern, assess woman risk factors for venous thromboembolism. So all of these are important. Then you are going to do general examination, including body weight, height, body mass index. Also, you should check for vital signs, pallor, jaundice, edema of lower limbs, and varicosities, and any signs of deep venous thrombosis. Abdominal examination is important to detect any tenderness, any mass, and also for palpation of organs. Local pelvic examination in some cases may be indicated if there is suspected adnexal mass. Also, you may need local pelvic examination with cascus speculum to do pap test, cervical smearing. Then investigation. All of these related to the first antenatal visit. Investigations needed like blood group and Rh factor, CBC, urine analysis and culture, blood glucose, HCV, HPV, HIV, and VDRL. Okay? Serum TSH in some cases with suspected thyroid dysfunction. Also, in some cases, I may need evaluation for hemoglobinopathy using profile blood test for women in certain countries in which this hemoglobinopathy is common, like in some Asian countries. So, like thalassemia, like sickle cell anemia, and so on. Hemophilia. Then ultrasound. Ultrasound between 11 up to 13 weeks is important to determine gestational age, detect multiple pregnancy, also screening for Down syndrome or Edwards syndrome and Vatau syndrome. especially for high-risk cases. As in this picture, we can see the nuchal translucency here increased in case of trisomy 21, and there may be absent nasal bone, nasal hyperplasia also. So ultrasound can help me in screening for Down syndrome, also to determine gestational age, to detect if there is multiple pregnancy, and of course the viability of this pregnancy. This is as regard the first antenatal visit. To summarize, in first antenatal visit, we are going to do pregnancy test to confirm pregnancy and accurate dating. We are going to take history from the patient, then do abdominal, general abdominal and local pelvic examination in some cases, then investigation, lab investigation, and ultrasound, as I mentioned before. This is as regard the first antenatal visit. Antenatal appointment at 18 up to 20 weeks offer pregnant women an ultrasound scan to take place between 18 and 20 weeks. Why? To screen for fetal anomaly, you can detect any organs anomaly or limb anomaly or skeletal anomaly. Okay? So, the best time between 18 to 20 weeks gestational age. Also, determine placental location. Okay? Okay. Next, antenatal appointment at 28 weeks. You are going to give anti-D prophylaxis for women with Rh negative. Okay? Who are married to Rh positive husband. Okay? Okay? So you are going to give her anti-D prophylaxis at 28 weeks. A blood test to check for blood count, blood group and antibodies, and the blood glucose test to screen for gestational diabetes. Then next appointment between 35 to 37 weeks. Okay, we will offer a pelvic exam to assess the presenting part, cervix, pelvic capacity, and any fetal-pelvic disproportion. The pregnant woman should be tested for group B streptococcus infection at this time, okay, to avoid neonatal sepsis later on, okay? So test for group B streptococcus infection at this gestational age. Then you are reaching obstetric diagnosis, which include the gravidity, parity, number of portion, gestational age in weeks, live presentation position of the fetus, associated with obstetric complication or medical complication, and previous uterine scar, if any. So, what about the frequency of visits? As I mentioned before, the World Health Organization recommends that antenatal care should be initiated within the first trimester of gestation with at least 4 and optimally 8 visits during the pregnancy. Okay? Okay, so at least the 4 visits, as I mentioned before. This is the most important one. But optimally, reach 8 visits. Okay? Okay. So, the WHO advises pregnant women to initiate contact during the first 12 weeks. This is the first antenatal visit, with subsequent contact taking place at 20, 26, 30, 34, 36, 38, and the 40 weeks gestation. If you counted them, you will find them 8. This is the optimum as regards WHO. In some countries, there is different program as regard for antenatal care. In some countries, they divide the patient into 2 groups. Of course, low risk, the visits will be less than high risk patient, okay? Because high risk patient will need more frequent visits. Low risk patient, every 4 visit every 4 weeks till 26 weeks gestation age, then every 3 weeks till 32 weeks gestation age, then every 2 weeks till 36 weeks, then in the last months weekly till the end of pregnancy. This is in some countries in low risk patient. But high risk patient with more frequent visits every 2 weeks till 28 weeks gestational age, then weekly till 36 weeks, then hospitalization or according to the condition of the patient. Okay? Okay. What about identification of risk factors? Identification of risk factors like pre-existing medical disease, like previous pregnancy complication, like risk factors for venous thromboembolism, like obstetric bleeding, like previous IUR, congenital malformation, or perinatal mortality. Also, evidence of poor nutrition and anemia is important. This is also a risk factor. It's considered risk factors, okay. And carry hazards for the mother and the fetus. What is the information to be checked in such visits? We summarized here in this slide information to be checked in such visits: abnormal symptoms like headache, abdominal pain, vaginal bleeding or discharge. Blood pressure measurement is very important to detect hypertension with pregnancy, preeclampsia. Also, weight of pregnant women and rate of weight gain, because it's more better to be in the average normal. Fundal height, fetal heart rate, symphysis fundal height, I mean, to know if the gestation age is doing well with the symphysis fundal height or not, or small for gestational age or large for gestational age, so I can detect the problem early. Fetal heart rate and the presenting part, fetal activity with the fetal kicks, size of the fetus, rate of growth, amniotic fluid index by ultrasound, and placental site. Detection as regard the implantation site by ultrasound, and the exclusion of any low-lying placenta or placenta previa. Also, exclusion of any congenital anomaly as regard the placenta and any abnormality of the placenta like placenta accreta spectrum or placental abruption and so on. Lab tests as indicated like CBC, blood glucose, urine analysis, vaginal examination in late pregnancy for presenting part, station pelvic capacity and cervical consistency, effacement and dilatation, which happen with starting of labor pain. Okay? Let us go to antenatal advices. What is the antenatal advices? This is very important to know the nutritional counseling. Nutritional counseling is a cornerstone of prenatal care for all women during pregnancy. Woman nutritional status not only influences her health, but also pregnancy outcome and the health of her fetus and the neonate later on. Okay, what about nutritional needs during pregnancy as regard daily requirements to maintain healthy pregnancy? Women need 300 extra calories each day during pregnancy. Okay, so the caloric intake during the pregnancy ranging between 2,200 up to 2,900 calories per day. Protein constitutes 60 to 70 gram. Carbohydrate constitutes 200 up to 400 gram. Okay, carbohydrate comprise 45 up to 64% of daily calories. So the majority of the calories coming from carbohydrate. The best food sources include whole grain breads and cereals, brown rice, root vegetables, legumes, and the fruits. What about lipids? Total fat intake should comprise 20 up to 35% of daily calories. Also, the woman needs sufficient amount of vitamins and the minerals, which would increase requirement of vitamins and the minerals like vitamin C, vitamin D, like iron and minerals, iron, Also, calcium is important, magnesium. Also, in vitamins, don't forget vitamin B, don't forget folic acid, which prevent neurological defect in the fetus. Fluid intake is important also, sufficient amount of fluid, water, 2.3 liter at least per day. Okay, so during pregnancy, women need folic acid, iron, calcium, vitamin D, choline, omega-3, fatty acid, B vitamins, and vitamin C. Also, enough fluids by drinking several glasses of water each day. Drink 2.3 liter, about 10 cups of water, in addition to the fluids in juices and soaps. This table shows some vitamins and minerals. It's important to know the daily requirement. This is for the non-pregnant, this is for the pregnant lady, and this is for lactation. Okay, please remember folic acid because it is important, very important. Folic acid, pregnant women need 600 microgram, okay, per day. But if there is history of neurological defects like neural tube defect in a previous pregnancy, so you should give the higher dose 4 milligram every day. Okay, so 0.4 or 0.6 milligram every day if low risk, if high risk 4 milligram per day. This is as regards folic acid and should start in the first trimester. And if there is previous history of neurological neural tube defect, like spina bifida, like anencephaly, and so on, you should start folic acid supplementation before pregnancy by 1 month at least, up to 3 months. Okay, then every day during the first trimester. This is very important. Okay, also iron supplementation start after the first trimester up till the end of pregnancy. The daily requirement during pregnancy is 27 milligram per day. Okay, of course, increased than non-pregnant lady. This is a daily requirement. Also, zinc is important, 11 milligram per day. Be careful about vitamin A. Vitamin A is dangerous because it can cause teratogenicity for the baby, can cause congenital anomalies if it is given in a high doses, more than 10,000 international units. Okay, so the requirement daily during pregnancy is 770 microgram per day. This is for pregnancy. Okay, also vitamin B is important, B1, B6, B12. Vitamin C is important also. The daily requirement during pregnancy in vitamin C about 85 milligram per day. Okay, this is as regard the requirements of different vitamins and minerals. You can see in this table in non-pregnant, pregnant, and during lactation. Okay, what about gestational weight gain recommendations? Okay, all pregnant ladies the same as regard the weight gain recommendation? The answer is no. They differ according to the weight. If the patient is underweight or normal weight or overweight or obese. Okay, tell me more, please. If she is underweight, I means less than 18.5 kilogram per square meter. Okay, the rate of weight gain in second and third trimester about 0.5 kilogram per week. But in normal weight, which ranging between 18.5 up to 25 kilogram per square meter, the rate of weight gain second and third trimester. We are concentrating on second and third trimester because the main increase in weight occurred in this trimester, not the first one. Okay, so here in this normal average weight woman, in average body mass index, we are going, the rate of weight gain is 0.4 kilogram per week. What about the overweight? The overweight woman ranging between 25 in body mass index, between 25 to 30 kilogram per square meter, this is considered overweight. What is the rate of weight gain of such woman in second and third trimester? About 0.28, 0.28 kilogram per week. Okay, so as you see, with increasing body weight, the rate of weight gain should be less. As regard in obese patient, equal to or more than 30 kilogram per square meter, the rate of weight gain in second and third trimester about 0.22 kilogram per week. Okay, so there is difference as regard the body mass index between women as regard the rate of weight gain in second and third trimester, like that. Okay, what else in antenatal advices? As regards smoking, should be avoided during pregnancy as it may cause intrauterine growth restriction, placental abruption, or premature labor. What about alcohol? Pregnant women can drink alcohol or not? Pregnant women shouldn't drink alcohol. Drink drinks containing alcohol, including beer, wine, liquor, mixed drinks, and malt beverages. Moderate drinking during pregnancy can cause behavioral or developmental problems for a baby. Heavy drinking during pregnancy can result in malformation and intellectual disability. And this malformation described with alcohol deformity, alcohol facial deformity, and so on. So we should stop alcohol drinking and smoking during pregnancy. Okay, what about rest and sleep? 8 hours at night and 2 hours in the midday is quite enough. What about exercise during pregnancy? Should you encourage exercise or stop it during pregnancy? Violent exercise as diving and water sports should be avoided. Housework, short of fatigue, and walking are encouraged. Okay, so you can encourage her to do walking, but violent exercise is not allowed. What about clothing? A woman during pregnancy needs lighter and looser clothes of non-synthetic material are more comfortable due to increased body basal metabolic rate and sweating. So cotton, made of cotton, clothes made of cotton is better, much better, and should be lighter and looser. Okay, clothes which hang from the shoulders are more comfortable than those requiring waistbands. Breast support is required. Breast support is required. Avoid tight elastic hosiery or its bands. Okay, so avoid any tight elastic hosiery or stocking or its bands. What about shoes? High-heeled shoes should be discouraged as they increase lumbar lordosis, and we know during pregnancy there may be little lumbar lordosis, so this will be increased with high-heeled shoes, so leading to more pain, more back pain and back strain. Also high-heeled associated with risk of falling on the ground, so risk of injury. So please avoid high-heeled shoes. As regard the bathing, shower bathing is preferable than tube or sea bathing for fear of ascending infection. What about vaginal douching? Is it allowed? It should be avoided. Okay. What about teeth care? Regular cleansing is important to avoid inflammation in the gum and pain in the teeth. Also consult the dentist when needed if there is any tooth pain or aching or inflammation in the gum, and so on. What about care for the breast? Can women wear bra during pregnancy? Yeah, women can wear a bra that provides firm support. What about colostrum? Colostrum is fluid secretion from the nipple. If it's coming near the end of pregnancy, clean this colostrum, okay, using only warm water. If colostrum leakage is a problem, woman can wear an absorbent pad in her bra and replace it when wet, when become wet, to avoid irritation or infection. So don't leave this area moist. So can put absorbent pad, okay, in her bra to avoid this inflammation in the area of the nipple and the area, okay. To reduce the incidence of retracted or cracked nipples postpartum, the woman is instructed to gently massage them with glycerin, olive oil, or coconut oil during the last 6 weeks of pregnancy. Okay, what about care for the bowel? Constipation may happen as the physiological changes during pregnancy under the effect of progesterone hormone with relaxation of the smooth muscle of large intestine. Okay, so constipation can happen. This should be avoided by increasing vegetables with fibers, fluids, and milk intake and mild exercise. Liquid paraffin shouldn't be used for long period as it interferes with absorption of fat-soluble vitamins A and D. So avoid using liquid paraffin. Okay? What about sexual intercourse? As regard coitus, is it prohibited during pregnancy or not? Okay, whenever miscarriage or preterm labor is a threat, coitus should be avoided. Okay? Otherwise, it is allowed with less frequency and violence. That's it. So, it is allowed so long as there is no problem, but with less frequency and less violence. But when there is threat of miscarriage, threatened abortion, or threatened miscarriage, or threatened preterm labor, should be avoided temporarily. Okay? What about traveling? Is it allowed during pregnancy or not? Yes, it is allowed. But long and tiring journey should be avoided, particularly if the woman is prone to miscarriage or preterm labor. Flying is not contraindicated, but not the long ones and the near term. The most suitable time for flying, for example, this is a very common question from the pregnant lady. The most suitable time at which gestational age? At gestational age 15 to 28 weeks. Okay, so in the mid trimester, this is the best time, not early during the first trimester and not too late during the last 2 months. Okay, and some airlines prohibit or prevent flying in the last months. Okay, okay. So, or she needs a letter from the doctor who do the care, okay, and so on. Because they are afraid that labor may happen during flying and so on. Okay, long distance travel, I mean longer than 4 hours, carries a small risk of DVT. So how can I protect the lady from DVT during flying of this longer journey? Women should drink plenty of water and move about regularly every 30 minutes. If she can do that, it's very nice. So she can move every 30 minutes, drink plenty of water. Also, she can use a compression stocking, will help in reducing leg swelling and DVT. Okay? Okay. What about medications during pregnancy? Medication shouldn't be taken without obstetrician advice due to risk of teratogenicity. Some medicines associated with teratogenicity and can cause congenital fetal malformation. So we should give the patient the most safe one. So prescription guided by the obstetrician only. Okay? Okay. What else as regard the antenatal advice? We should tell the pregnant woman about avoiding exposure to infection, especially those documented to be teratogenic. Like what? Like rubella, German measles, which is rubella, okay? Cytomegalovirus, herpes huminis, and varicella zoster virus, because it is proved these viruses is proved to be teratogenic and can cause congenital fetal malformation. Exposure to irradiation also should be avoided because it can cause many congenital malformations. Let us go to an important point, which is the warning symptoms during pregnancy. These warning symptoms indicate immediate contact to the obstetrician, like vaginal bleeding, abdominal pain, gush of fluid per vaginal due to premature rupture of membrane, persistent headache, blurring of vision, persistent vomiting. All these are called warning symptoms during pregnancy. What about vaccines during pregnancy? Should pregnant lady be vaccinated, and which type of vaccine can be given? CDC recommended that pregnant women get 2 vaccines during every pregnancy. One of them, the tetanus diphtheria pertussis vaccine, the TDAP, tetanus diphtheria pertussis vaccine, can be given optimally between 27 and 36 weeks of gestation. What is the other vaccine given during pregnancy? The inactivated influenza injection vaccine. Pregnant women can get flu shot during flu season by the end of October. Okay? But you should know that live attenuated nasal spray flu vaccine is not recommended. So I'm not giving the live attenuated nasal spray flu vaccine, but I'm going to give the inactivated one. Okay? Why I can't give the live attenuated nasal spray flu vaccine? Because potential risk to the developing baby. Because it is not killed virus, it is live attenuated one. Okay? So I can't give it to pregnant lady, but I can give the inactivated influenza injection given intramuscular. Okay? Okay. So 2 vaccines, Tdap, tetanus diphtheria pertussis, okay, given at gestation age 27 up to 36 weeks. And the second vaccine is the inactivated influenza injection vaccine given during flu season by the end of October. Also, if it is given later on, it can also protect. What about live attenuated viral vaccine? They are contraindicated during pregnancy. Like what? Like varicella vaccine, human papillomavirus vaccine, measles, rubella, and mumps. All of these live attenuated viral vaccine all of these are contraindicated. Okay, what about travel vaccines? Yellow fever, typhoid fever, and Japanese encephalitis. All of these shouldn't be given during pregnancy unless the healthcare provider determines that the benefits outweigh the risks. What about COVID-19 vaccine for pregnant women? It is under research, and we can see later on in the guidelines what about it during pregnancy. Okay? And if the benefits outweigh the risk, it's okay, and so on. Okay, if there is any side effects of this immunization, some common side effects of immunization include pain, redness, and swelling of the injection site, muscle or joint pain, some fever, and or chills. Many people don't experience any side effects, and so on. Severe side effects related to immunization, like anaphylaxis, is extremely rare. This is the end of my lecture today. This is my books published on Amazon: textbook of obstetric, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy and the gynecologic oncology. You can go to Amazon to find my books. You can go to my link on YouTube to find more lectures, and I'll put my site on Amazon and my site on YouTube on a comment. Thank you, everybody. My best wishes for all of you.